Intravenous thrombolysis is not recommended in acute ischemic stroke if the time of onset is not known, or if the stroke occurred more than 4.5 hours earlier. However, in some unwitnessed acute ischemic strokes, including those with symptoms on awakening, patients are unaware of the time of symptom onset. MRI that shows an ischemic lesion on diffusion-weighted images, or DWI, but no marked parenchymal hyperintensity on fluid-attenuated inversion recovery, or FLAIR images in the same region, a DWI-FLAIR mismatch, can be predictive of symptom onset within the previous 4.5 hours. The role of intravenous thrombolysis in patients with acute stroke of unknown time of symptom onset and a DWI-FLAIR mismatch is unclear. In this multicenter randomized double-blind placebo-controlled trial, 503 patients diagnosed with stroke with an unknown time of symptom onset and a DWI-FLAIR mismatch received intravenous alteplase or placebo. The primary endpoint was a favorable clinical outcome, defined as a score of 0, no symptoms, or 1, no significant disability despite residual symptoms, on the modified Rankin scale at 90 days after the stroke. The primary outcome occurred in 53.3% of the alteplase group and 41.8% of the placebo group. There were 10 deaths with alteplase and 3 with placebo, a difference that was not statistically significant. Clinically significant extracranial bleeding was observed in 3 patients in the alteplase group but was not observed in the placebo group. There was no difference in the rate of intracerebral hemorrhage. The authors conclude that intravenous thrombolysis with alteplase improved functional outcomes in stroke patients with unknown time of symptom onset and MRI findings of a DWI-FLAIR mismatch. Full trial results are available at NEJM.org.